All right, as we head into the winter months, coronavirus is still on the top of everybody's minds, but we need to also remember that it's flu season.
Yeah, it's flu season as well, and that can really complicate things during this pandemic. And joining us now is Dr. Edward Yoon, the Chief Medical Officer, United Healthcare, Medicare, and Retirement New England. Thank you so much for being with us.
Oh, thank you for inviting me.
First of all, doctor, can you explain the difference between coronavirus and the flu? Is there a huge difference, or are they similar?
That's a great question. So there are similarities and some differences. So first, the similarities. They're both respiratory viruses. So the presentation both can cause a wide range of symptoms, such as being asymptomatic to mild disease to severe illness. And both, because they're respiratory, are transmitted by contact or droplets. And, the good thing, one good thing out of it is that the same public health measures to control flu or COVID work, such as hand hygiene, social distancing, and mask wearing. Now, the differences, those are the similarities. So the differences are that the speed of how COVID-19 and flu differ. Flu actually has a shorter incubation period, which means that when we're initially infected, the symptoms will appear sooner.
Okay.
This means that folks with the flu can show symptoms faster than folks who get COVID-19. Now, the other difference is, unfortunately, is that COVID-19 tends to be more contagious than the flu. And there's some research showing that that airborne transmission might be possible. Now, as far as who it affects, the flu, as we know, usually affects the young children, pregnant women, elderly with chronic diseases. COVID-19, we understand that it usually affects the older population with underlying conditions such as diabetes, obesity, and high blood pressure.
Okay.
So without getting a test, is there a way that you can tell if you have flu or COVID-19, or do you need to get a test?
So they're so similar in their presentation, and to really to know the difference, a test is needed. But that brings us to what we should do when we start having some symptoms. And initially, the first thing is to obviously protect others, protect ourselves by staying away if we are infected, or staying away from folks who are infected. There's really no way to tell unless a test is done. But what we can do is do some preventive measures, such as making sure we wash our hands, cover our coughs, sneezes, and social distancing. So yeah.
Okay. If I'm already sick, is it too late to get a flu shot?
No, not at all. I mean, there are certain situations where most providers would hold off on, and that's usually if folks are have high fever, or are showing signs of being really sick. But we don't know which viruses may be causing these symptoms. So no, I think that's one of the key preventative measures that we can continue in this crazy year of COVID.
Right. Okay.
Well, Dr. Yoon, thank you so much for being with us. We appreciate your time today.
Oh, thank you very much. I love your tree, by the way, and your sweater.
It's the Dr. Yoon tree. We decorated it just for you.
Love that.
That's great.
Thank you so much for your time. We wish you a happy holiday.
You too. Take care.
Okay, bye-bye. You can, for more information, visit uhc.com or follow on social media at UHC. He was